Okay, thank you for the invitation. And today I'm going to, on behalf of Target STEMI OCT China Steering Committee and investigators, I would like to report this randomized comparison of kidney response between Firehawk stent and the science stents in STEMI patients at a 6-month follow-up. And this is an OCT study. So I have received some grants and research support from Microport. And so first I need to introduce why we want to do this study. So we know that this biodegradable polymer DES reduces inflammation or improves vascular healing is still debatable and depends on several factors. They include strop thickness, polymer and drug density, and elution kinetics. And Firehawk has a unique design. It has a lower drug and polymer density of this biodegradable DS. And in an all-comers population, this target AC trial shows Firehawk is non-inferior to science in terms of target lesion failure of 12 months. And also, target AC have OCT sub-study and demonstrated the Firehawk has similar vascular healing with science at 3 months. However, STEMI patients were excluded. And so this target STEMI OCT China trial was to compare the OCT assessed neointimal thickness of Firehawk versus science at 6 months in a STEMI population. So Firehawk, as we said, it has similar metal material compared with science and a similar strop thickness, and it has a bigger cell area compared with science, and it has a unique polymer. It's a polylactic acid, which is a bioresorbable polymer, and it will degrade among 6 to 9 months. And the polymer thickness is 10 micrometer, but it's all in aluminum groove, and which is can control the drug release, target release. And the drug syronomers, 90% will elution at 90 days. And the drug density is very low, it's only 0.3 microgram per square millimeter compared with science. And this is our major enrollment criteria. We include subjects more than 80 years old, STEMI within 12 hours of symptoms onset. Subjects have at least one de novo culprit lesion in a native coronary artery, or acute infected related artery, and requiring primary PCI, and ejection fraction more than 35%. Reference diameter between 2.25 and 4 millimeter, and target culprit lesion length less than 100 millimeter. And we need successfully crossing the occlusion with guard wire and blue inflammation that make the stent deployment feasible. And exclusion criteria, we include the bypass grafts, bifurcation, left main disease, and also instant total occlusions. And we include 44 patients in 3 sites in China, and randomized into Firehawk and the science group. And we have a primary endpoint at a 6 months OCT follow-up, and we have 1 month and 12 months clinical follow-up. The primary endpoint is neointimal thickness in OCT at 6 months. Safety endpoint, target lesion failure at 12 months. Secondary endpoint also have a percentage of uncovered struts at 6 months by OCT. And the DAPT, we give DAPT 12 months per guidelines. And we so estimate the neointimal thickness of science was 100 micrometer. And we assume no difference between 2 groups, and the standard deviation of 45 micrometer for each group, and a non-inferiority margin 45 micrometer. And so with one-sided alpha 0.05 and the attrition rate 25%. So we have the statistical assumptions of a total of 44 randomized subjects will provide 85% power to demonstrate non-inferiority using the t-test. So here is our flow chart. And 44 patients randomized to 2 groups. We have 21 in Firehawk and 23 in science group. And we have 19 patients complete 6 months OCT follow-up in Firehawk group, and 100% of patients complete 12 months clinical follow-up. We have 22 patients complete OCT in science group, and 100% completed clinical follow-up. So here, this is the baseline characteristics. And we have a relatively young age, so about 50 years old for both of groups. And we, among 2 groups, has no difference. So regarding these risk factors and also the medicine. And for this device, we have each patient have a 1.24, the 1.2 between 1.2 to 1.3 stents per patient, and have similar similar rate of LAD and RCA. And we have more than 70% of patients with STEMI flow 0. And we have more than 50% of multivessel disease and more than 80% of lesion classification B2 and C. And we have almost 50% of patients with thrombus aspiration. We have over 50% of complete revascularization, and a relatively low residual syntax score for each of group. So here is our primary endpoint, and we have 33 micrometer in Firehawk group, and almost 79 in science, and we no difference compared with 2 groups, and also we meet the non-inferiority criteria. So each group have over 90% of stent coverage, strass coverage percentage. So in male opposed strass, both of the group less than 0.2%, which is very low. And also we have a pretty low instant lead loss of each group. So in Firehawk, it's 0.3 millimeter, and in stent net loss, and in segment net loss also has no difference between 2 groups. And here is essential result of cumulative frequency distribution curve at 6 months of OCT result. We can see that regarding neointimal thickness, we have meet non-inferiority. No difference between covered strass percentage, low difference of in-stent lateral loss and in-segment lateral loss. And here we show the each stents, the OCT result of representative OCT results of each patients, and with 100 micrometer the color change. So we have a red uncovered strass and purple male opposed strass, and which is very low in each group. So at 12 months, only 1 patient in the Firehawk group experienced a clinically indicated target lesion revascularization, and no other target lesion failure or stent thrombosis events occurred in both groups. So this study, we the essential to remember is first, the healing response of Firehawk in STEMI patients still remains unclear. So, and so that's why Firehawk biodegradable polymer DS was evaluated in this STEMI population in China. And the primary endpoint of neointimal thickness assessed by OCT have more than 85 power to demonstrate non-inferiority to science at 6 months. And Firehawk was non-inferior to the science stent in terms of neointimal thickness and meet non-inferiority. And in patients with STEMI, Firehawk was non-inferior to science in vascular healing at 6 months. Both stents exhibited nearly complete strut coverage and moderate neointimal formation and minimal strut malposition. So that's my presentation. Thank you.
Thank you very much. That's a wonderful presentation. One of the questions would be, why did you do a study in STEMI with the Firehawk?
Yeah, I think it's a very important question. And first, we all know that the target AC published in 2018 and showed very good results compared with Firehawk and science. And it shows a similar target lesion failure, and also the OCT subgroup at 6 months should also almost complete strut coverage at 3 months, but not include a STEMI patient. So I think it's still very important to explore this Firehawk, the stent design, because this stent is designed to balance the restenosis and also the vascular healing. So because it has still a lower anti-proliferative drug, but still effective. And so if we want to show that if this stent is also have a very excellent performance in STEMI patient, especially for vascular healing, I think it's still need to perform this OCT study and to show the evidence that this stent is also has very good vascular healing at 6 months in STEMI patients. I think it's important.
Fantastic. Yeah, I always wanted to do that study. I totally agree. A question for Peter. Target STEMI OCT, it's conducted in China, but we know we have some studies elsewhere. Can you give us an update on?
Yes, we.
Yeah.
I think
maybe I can share the slides.
Tony, no.
That's so that's Peter Smith. We want to answer. Thank you.
Yeah, thank you. But if I can have the first slide, maybe from your presentation, because your study is a kind of a good pre-study for the target first study that we are now conducting here in Europe. It's an international. We don't see the slides yet. Can we have the slides?
Yeah, I will show you the slide. I will share.
Thank you. That's a truly global presentation now.
Yeah, sorry. Let me share the slides again. Can you see the slide?
Not yet. If you can share it.
Sorry. Let me see. I need to.
Why don't you just talk us through?
Yeah, well, I can already introduce you to the target.
Caroline, it's okay. Let's just introduce the trial. Huh?
I will introduce the trial. It's an international, well, it's an European randomized clinical trial evaluating the shortened DAPT, a shortened antiplatelet therapy strategy with the Firehawk stent in acute MI patients, and also with a complete revascularization strategy. Yeah, I think we got the slides. Yeah, okay, well, this is the background. Well, we'll know that acute MI has an increased thrombotic risk, and therefore we give prolonged DAPT. Well, we all know that prolonged DAPT has kind of a balance. On one hand, we limit ischemic risk. On the other hand, you have an increased bleeding risk. And we all know that even bleeding risk is associated with a worse outcome and higher mortality. We also know that nowadays from the COMPLETE trial that complete revascularization is the preferred strategy in multivessel STEMI patients. And we also know from other trials like the TWILIGHT and the TICO and the MASTER DPT that a shortened DPT regimen, even in ACS patients, have benefit for reducing the bleeding risk and having the same ischemic risk when compared to a standard DPT regimen. So the target first more or less extends on this reduction of DPT, of antiplatelet therapy regimens in acute MI patients. So low to moderate risk acute MI patients are going to be randomized at 1 month and after they have received complete revascularization with the Firehawk stent, and after 1 month P2Y12 monotherapy will be started. So this is the next slide. Yes, perfect. So it is a population of 2,100 non-STEMI and STEMI patients that will have successful and complete vascularization with the Firehawk stent within 7 days. The complete vascularization has to be done within 7 days after the index procedure. And if they are event-free, they are at 1 month randomized towards an experimental arm, meaning stopping aspirin and continuing P2Y12 inhibitor up to 12 months, compared to the standard regimen of 12 months DPT. The primary endpoint is NACE, the composite of all-cause death, MI, definite and probable stent thrombosis, stroke, and major bleeding BARC3 or 5. The secondary endpoint is BARC2, 3, and 5 bleeding, and which we hope for, where we hope for superiority with the experimental arm. If you can have the next slide. So this study is ongoing. So we aim at 2,246 patients in total in 6 countries and 40 sites. On the bottom, you see a kind of a dashboard of the current status. You can see that we are in enrollment. We are over 25% of our enrollment, and that all countries nicely contribute to the study. We have a good contribution of France. What is nice to show on the right is that the amount of STEMI patients and non-STEMI patients is equally divided, and that the patient receiving a P2Y12 receptor blocker mostly receive ticagrelor, and in the majority in prasugrel, and a very small portion clopidogrel. So this is the what I would like to show to you on the target first study that is ongoing.
Thank you very much. So these were the new ones, target OCT, STEMI, target first. To wrap it up, I can report on target AC. It has been mentioned, the study that randomized in all comers the Firehawk stent versus the Xience. We've just completed the 5-year follow-up, and that should be presented at the ESC. That's very interesting, very long-term data. With that, we move on. And we go into valves now.